morning. I start by offering my condolences to those families that lost loved ones, and you remain in our thoughts and prayers. Again, our concern is Western New South Wales. Overnight there were 54 cases. 32 of those cases were in Dubbo. Wellington and Bathurst both had 5 cases. In Burke, 8 cases. Narromine, Mudgee, Brewarrina and Parkes all had a case in each of those communities. We are concerned. In the far west, 4 cases again, and they all were in Wilcannia. The Hunter New England Local Health District, again 2 cases, this time in Lake Macquarie Local Government Area and the Port Stephens Local Government Area. In the Illawarra, we have 4 cases in Wollongong and 1 case in Shell Harbour. On the Central Coast, concerns again around the 4 cases on the Central Coast, and in southern New South Wales we had that case that we reported yesterday in Googong or in Queanbeyan, and nothing more there. I do want to highlight vaccination rates continue to climb in regional and rural New South Wales. We've seen the latest data from the week ending last week. Southern Highlands are seeing 68.5% first doses with a 41.8% second dose. So that's a really good example of regional communities coming forward. And even on the Central Coast, 63.9% first doses and 35.4% double dose. Again, the message to everybody in regional rural New South Wales is to get vaccinated. We are running walking clinics right across the regions, so keep an eye out for that. Of course, our health clinics, our pharmacy network, our GP network, all providing the opportunity for vaccination in the regions. It's part of our freedom and, of course, part of our future. Thank you.
Good morning. My name's Michelle Dowd and I'm the Nurse Manager at Intensive Care for Liverpool Hospital. I'm here with you today to share what it's like for intensive care nurses on the front line during this pandemic response, and to encourage you all to please get vaccinated. Intensive care units in our hospitals are where we look after our sickest, most vulnerable patients. We work in a large team of health professionals and support staff to look after the sickest patients in the hospital. These are patients who've been victims of trauma, patients who've had strokes, cardiac arrests, major surgery. To keep everyone safe in our intensive care unit right now, we've essentially divided it so we can keep the COVID and the non-COVID patients separate and protect the most vulnerable. The Delta variant is just that contagious, and that's why vaccination is so very important. Intensive care patients need one-on-one nursing care. They need to be monitored really closely so that we can respond immediately in case they deteriorate. If you or your loved one is in intensive care right now for any reason, you may not be able to have visitors. We know it's really hard at the moment to be separated from your support network, but the amount of virus that's circulating in the community just poses too much risk to our patients.